Yes. Hello, everyone, and welcome. If you have questions about ADHD for your child or for yourself, this is the live stream for you. You know the rules. If you got a question, put it up. I'll bring it up onto the screen. I'll do my best to answer it. In today's time, I put together a list of the most common questions that I get in regards to ADHD management, particularly in children. So this is our time to discuss this candidly. Please put in your comments or your thoughts, and we will do our best to address those. That being said, thank you for sharing the lunch hour with me. Let's get started. Okay, everybody. First things first, we want to talk about ADHD. And the thing we're going to talk about first is the best question there is. This is the best question there is. Does your child actually have ADHD? Now listen, if you're watching this, last semester didn't go well. Maybe last year didn't go well for your child, and you did all the right stuff. You met with the teachers, you were attentive, you did the work after school, maybe you got a tutor, you met with the school in regards to 504 or IEP interventions, and you did great. Okay, you did great. Just because you're asking this question in regards to your child doesn't mean it's bad. It doesn't mean it's wrong, and it doesn't mean that you're wrong in wanting the right information. But you have to start the journey right here. Does your child have ADHD? Well, let's talk about it. The first question you have to ask is, does your child meet diagnostic criteria? And this is Googleable. Okay, you don't need to be on a live stream to learn this, but we have to start here, okay? I've been doing this work for 20 years, and you have to start here. This doesn't mean that you're going to necessarily treat every child who meets all of these criteria, because there's other things to consider, but we have to start here. Does your child have hyperactive and impulsive features that would demonstrate hyperactive impulsive ADHD? So are they fidgeting and sitting, can't sit, are restless, on the go, talking, all these things, right? You need 6 out of those 9 specified criteria in order to meet the diagnostic definition of hyperactive impulsive ADHD or inattentive ADHD. So let's go to the right side. You have to have 6 of 9 of those criteria. I don't pay attention. I don't follow through. I don't listen. These are things that you know, okay, that you know. But if you really want to know what to do about ADHD, the most common question that people have, and we have to start with, is, does your child actually have this condition? Now, if they've met the diagnostic criteria, right, the things that we just went through, all those things, there's another set of questions, okay? And that is, well, what does this child look like at school? Okay, so if you're like me, I don't really know what goes on at school. I remember what went on at school when I was a kid. It wasn't great, but you don't necessarily know how these types of difficulties are manifesting in the school. So meeting diagnostic criteria is one thing. Meeting diagnostic criteria at school is another thing. And that's where you can use forms like this. This is called a Vanderbilt form, okay? You can send it to the school. You can print this off yourself. You just Google Vanderbilt ADHD PDF, print it off, give it to the teachers, and you'll get information about what your child is manifesting and demonstrating in the school system. So, and this is really just an operationalizing of the diagnostic criteria. It's split into 2 groups, to 2 halves, I should say. You've got the first 9 criteria, which is inattentive features. You've got the last 9 criteria, which is hyperactive and impulsive features. If you send this to school and they send it back to you and they've circled a bunch of 2s and 3s, the likelihood your child's demonstrating ADHD features at school is super high. But we're not done yet. We're not done yet, right? The first frequently asked question is, does my child have ADHD? Okay. But you can meet diagnostic criteria, okay, both at home and in the community and at school. But there's still one important piece of the puzzle that you have to consider if you're wondering if this is the semester, if this is the school year for ADHD treatment of your child. And that is your child impaired? Is your child impaired by these problems? Listen, kids are hyperactive. Kids are inattentive. Kids are impulsive. Okay? It doesn't necessarily mean that they need a medication to manipulate the neurochemistry of their brain. All right? How do you know when it's time? Well, when you've met all the criteria, and most importantly, I would argue most importantly, your child is impaired. Impairment means sadness. Oh my goodness. So many people get frustrated at these kinds of videos. You're like, doctors are terrible and there's too many kids on medicines. And look, I don't disagree with the second one. I don't disagree that there's too many kids on medications. I agree with that, right? But you have to understand that doctors aren't riding around in white vans looking for kids that might be a little inattentive and then hoping that we can put pills in their mouth. That's not what I want at all. I want zero medicines for zero children. Okay, I do. But if your child's impaired, so their life is a dumpster fire. They struggle at home. They struggle at school. They struggle at their sports teams. Grandma and grandpa are annoyed by them. School is annoyed by them. The child annoys themselves. You just finished Christmas break and you are thankful they are back in school because they are so hyperactive, impulsive, and inattentive. Their social relationships, their friendships, their ability to come to the right conclusions about who they are and what they're good at is so skewed because the only interactions people have with them are, you've got to sit, you've got to listen, you've got to be better, you've got to be different. That's impairment. And that's much more complicated, much more heavy, and much more sad than people who just meet arbitrary diagnostic criteria. So, does your child have ADHD? Well, if they met the criteria and they're impaired, the answer is yes. But what happens next comes later. All right, let's ask this question. This question is a super common one. What type of evaluation is needed, right? People come to the clinic and they'll wait 6-9 months to get an assessment sometimes, depending on where you live in the country. And they'll come in and they want an assessment, an evaluation for ADHD. But what you have to understand is there's several different paths that you can take, okay? The first path we're going to say is a more aggressive and comprehensive path. And that is a path where maybe you do a multidisciplinary evaluation. You see a physician, somebody like me. You see a psychologist who does some neuropsychologic testing, right? We get working memory, processing speed, verbal IQ, performance IQ. We get all these complex pieces of information that then help us determine where the strengths and weaknesses are for the child, often leading us to the diagnosis of ADHD. But there's also an evaluation that can be done with your primary care provider. You determine if the child meets criteria for ADHD, as we discussed in the previous section, and then you learn what school has to say through a Vanderbilt, and then you determine if the child's impaired, and then you go through and make sure the child's safe to receive a medication, which again we'll talk about in a little bit, and then you can initiate therapy. So you can go a number of different directions in order to get an assessment for ADHD. It can be as complicated and prolonged as a multidisciplinary evaluation, or it can be as quick and as simple and comprehensive as a visit with primary care provider. Sometimes one is better than the other. It just depends. But please know that you don't have to go with a Cadillac assessment to get information on how to help your child tomorrow. So what type of evaluation is needed? It just depends on what's available in your community. But know that this issue can be met by your primary care provider. Next question, how young is too young? This is a tough one. Okay, let's start with insurance. If an insurance carrier is going to cover a medication for ADHD, a lot of times, not always, but private insurance carriers can cover these medications down to age 4, okay? Which I know sounds really young, and I get it. We're going to talk about it. But if you're on a state plan, like through the state of Iowa, like a Medicaid plan, you're not going to get ADHD medications. So like Ritalin, as an example, is not going to be covered under that insurance carrier under the age of 6. So if you're asking an insurance company, there are cutoffs. But if you're asking a clinician, there are times when children who are younger than age 6 benefit from an ADHD medication. And what I mean by that are stimulant medications like Ritalin or Adderall, these kinds of things. And I know how that sounds. But let me explain. If you've got a child who had in utero exposures to methamphetamines or a child diagnosed with a fetal alcohol spectrum disorder, their processing speed and working memory have been negatively affected by those teratogens to the extent that this child is going to struggle not just in focusing and attending to task, but in just general safety. right? These are kids that are going to, run out into these are kids who are predisposed to making really dangerous decisions, like running out into the street or running into the pool, right? And in those types of situations, if an ADHD medication can minimize that level of impulsivity and maximize our ability to keep that child safe, there are times when even a 4-year-old can be treated with an ADHD medication. But in general, we're going to defer to 6 and older because I want to see what preschool looks like. I want to see what kindergarten looks like. I want to give school the opportunity to optimize their academic environment so that the child can get a 504, get an IEP, and you can work on the things at home and have good communication with the teacher. I want to see what those things look like. So I want to turn all those knobs all the way up before we consider an ADHD medication. Okay, so how young is too young? Could be 4, could be 6. Most of the time, we're going to try and get to 6 before we really think about a pharmacologic intervention. What can we do to help? This is a great question. And again, it gets back to this idea of what knobs can we turn? What things can we optimize? What can we do to maximize our child's ability to focus and attend to task, to learn the necessary skills, to build on skills in a scaffold manner so that they're ready to move on to the next grade level? What can we do on our own to avoid the use of an ADHD medication? Yes, I prescribe them. Okay. Yes, I've seen these medications change people's lives. And yes, I have been on all of these medications. Big surprise to those of you who are watching. And I'll tell you, they have a place and they're very valuable. Okay. But before you get to that place, you have to do the hard work of figuring out what you can do to help your child be successful. So there are several things to consider. Let's talk about behavioral modifications, okay? Let's begin with modifications that we can advocate for through school. These are things like IEPs and 504s. I've done videos on this in the past. If you're not familiar with those terms, go watch those videos. You'll learn some good stuff. But those are basically agreements between the school and you on behalf of your child to provide interventions to help them focus and attend to task and build on learned skills so that they demonstrate the necessary progress. Let's talk about goals. Listen, so many times I have seen people say, well, I tell them to go and do this and this and this, Noble, and they don't do it. And I'm thinking, well, they're 6 and you told them to pick up their socks, put their shoes away, fold their bed, bring the towels down and get a coat. I'm telling you, I'm 37 years old. I'm 47 years old. I'm 47 years old, and I don't even think I'd be able to handle that. I got a thimble full of processing speed and working memory, right? So do these kids. So sometimes the goals that we set for these kids, they're just not realistic, right? You want to break them down into small, achievable steps. You want to be consistent with the time of day, with the setting, with the people. You want to be as consistent as possible, right? You want to have immediate consequences. Let me ask you this. Why is it that kids with ADHD can sit and play video games for 10 hours? Right? Well, how is that even possible? It's because when you push buttons and things happen on a video game, things happen that come back to you, right? So it's a cause and effect. It's a this happens and then that happens. If you want to incentivize a child to focus and attend to task, either at home or at school, you want to put things in place that when things are accomplished, something happens on the other side of that that provides feedback, right? That says, hey, this is a good journey. Let's keep moving forward. Choose your seat carefully. Choose it carefully. Don't put these kids by windows and by doors where they can look out and be distracted by what's going on in the hallway. Don't do it. Write things down, right? So many of us have moved away from iPhones and electronic reminders and back to just writing it down because the motor memory locks it in. And then lastly, set up procedures and routines for your child. I'm not trying to give you more things to do, more things to worry about. But remember, the question that people are asking is, what can we as a family do to help our child attend to task without medications? And as we've just discussed, there's a lot of things that you can do. Is the medication safe? Man, I've only been on YouTube for like a year, a little over a year, and I will tell you, if you talk about medicines in kids, if you talk about treating children with ADHD or any number of different things, there are a lot of people who get really mad. Okay. And I get it. I get it. Is there a group of kids that maybe we're treating and we shouldn't? And is that an issue? Yes, I'm not debating that. But if we're going through the steps that I'm laying out, my hope is to minimize that. Certainly that's my goal in the clinic that I'm a part of, is to minimize that. I don't want to treat kids who don't need to be treated with medications. Okay. But the question is, right, if we're using a medication, are these medications safe? Well, let's talk about it. What are things that you need to think about in order to ensure that your child is safe to take an ADHD medication? Remember, if you're watching this, maybe you're thinking about getting an evaluation for your child. Maybe you're questioning whether or not your child should continue to be on an ADHD medication. And we have to start this part of our discussion by determining if your child is safe. Cardiac. Okay. Now, if you have a family history of sudden death, if your child has been told they have funny beats or skip beats or blacking out or passing out or EKG, arrhythmias like Wolff-Parkinson-White or these other kinds of things that have been handed down through your family, that is important to know when we're thinking about prescribing an ADHD medication, because what do these medicines do? Well, they can speed up the heart rate. Right? They might affect the pressures to some extent. Does your child have a congenital heart disease? Right? Are they seen by a cardiologist? Whenever I prescribe a medication in a child who has a congenital heart disease or is being treated by a cardiologist, I always talk to the cardiologist before we start the medicine in order to ensure that this is safe. Sometimes children, if you have an ominous family history, you may not necessarily need to see the cardiologist. You've never had an issue, but you may need an EKG for your child, and it's not wrong to advocate for that during the assessment, particularly if you have a family history that is concerning. Body mass index. Let's talk about body mass index. If your child has a body mass index of 13 or 11, right? They're on the thin side. They're at the 3rd to 5th percentile in terms of their growth on the growth chart in terms of weight. These medications, which we'll talk about later, these medications negatively affect appetite. So your child's weight will likely go down, particularly if they're on an effective dose of these medications. Effective doses of ADHD medications almost always negatively affect appetite, and your child's weight will likely become a concern. If you're starting out this journey really small, your child it may become even more difficult for them to maintain their weight. So please know that is a very real concern that people have. Medication interactions. Some people are on other medications. Maybe your child's on an anxiety medicine. Maybe they're on a blood pressure medicine. Maybe they're on a medicine for renal or kidney disease. We have to take into account those medications and make sure that we don't start a medicine that's going to negatively interact. What about aggression? Sometimes ADHD medications will negatively impact aggression. They'll make an irritable kid more irritable. Okay, what I tell families all the time is, listen, ADHD medications, okay, are not decision-making medicines. They're not. They're not medicines that make you make better choices. These are medicines that make you really, really good at making whatever decision that you were going to make anyways. Okay, so if you're really into making terrible choices, an ADHD medicine it's possible that an ADHD medicine is going to make you really, really good at making terrible choices, right? They're not medicines that are going to change choices. They're just going to give you a minute to think about it before you do it. And if you're aggressive, it may cause things to become more irritating for your child. If your child struggles with sleep onset difficulties, if they struggle with social concerns, these are things that might also get worse, because sometimes ADHD medications can withdraw you. You can withdraw, right? This is what people mean when they talk about being a zombie. Zombies, I don't think is the right description here, but I understand what you mean, right? This withdrawn. I become so focused on what's in front of me that I'm less interested in what's going on over here. And that can be a very withdrawing effect. And these kids can kind of just move through their day hyper-focused on what's in front of them. And sometimes that's hard, right? That can be a really hard thing to watch, and certainly something that we don't want to contribute to if we can avoid it. So, safety first. Okay. Another question that people often have in the evaluation is, hey, look, Noble, I think there's some focus and attention issues, but I think there might be something else going on here. I think we're missing something else. And I would say, well, the likelihood of that is high because ADHD medications have a lot of comorbidities. Okay. They have psychiatric comorbidities, right? Things like anxiety, depression, oppositional defiant disorder, conduct disorder. They also have learning difficulties. ADHD, and I've said this in other videos, is like a white van, right? It doesn't go anywhere by itself. ADHD's driving and the ADHD is a lot of fun, but out of the back of the van comes a bunch of rabble-rousers that may cause some trouble at the party, right? Oppositional defiant disorder or conduct is an example. So ADHD doesn't travel anywhere by itself usually. So you're probably right. There probably are comorbidities to consider. There might be developmental things to think about. Developmental things, and what I mean by that is kids who have global developmental delays, right? Kids who have sensory or vision or hearing deficits, okay? Kids that have a level of cognitive impairment to where they're not tracking with fourth grade work because they're not doing fourth grade work. So they look like they have hyperactive and impulsive and inattentive ADHD, but they actually have maybe an intellectual disability or a severe and profound learning disorder that's contributing to them being more than a lap behind their peers. The primary difficulty there is not ADHD. It's a learning difficulty, okay? Maybe it's neurologic, all right? Now, this might be a stretch, but I'm telling you, I've seen it many times. Kids that stare off into space, either for seconds or for up to a minute. Sometimes they do it multiple times per day. Sometimes they do it a few times per day, and they're tired afterwards. Those are kids that you should be concerned maybe having a seizure disorder, okay? Not all seizures are when you fall on the floor and shake. Some of them are more subtle and certainly look like an inattentive ADHD. Some kids have underlying genetic conditions. An example here would be neurofibromatosis or tuberous sclerosis. I've seen kids present to the clinic with for an evaluation of ADHD, right? But then you look and they've got capillary macules all over their torso, and that is indicative of a neurocutaneous disorder. And it may not be something as simple or as straightforward, as obvious to spot as that, but oftentimes kids can have underlying deficits or genetic conditions that are contributing to their ability to focus and attend a task. And we have to zoom out and think more broadly about this. Maybe they have psychosocial or environmental stressors, right? Maybe the family's going through divorce. Maybe the child's homeless, right? Maybe they're having adverse childhood experiences where, there's an alcoholic in the home or there's a lot of violence in the home. Maybe they have medical conditions like asthma, right? And they're put on a steroid that they're taking systemically, so like an oral steroid that they're taking that is activating them. Or maybe they have obstructive sleep apnea, right? And they're not sleeping at all, and they're up half the night snoring and waking up sweaty and scared. And then they come to school and they're exhausted and they're gassed, and they need to see a sleep doctor or an ear, nose, and throat doctor to deal with this issue. So are there comorbidities? Yep. Should you think about it before treating them? Absolutely. And remember, your primary care provider or the physician or psychologist who's assessing you is certainly capable of zooming out and asking broader questions. But for some reason, if they don't, it's important as a parent that you do. Okay, you have to think about these things because remember, the goal is not to treat a kid with a medicine for ADHD if we can adjust other knobs and minimize their hyperactive and impulsive features without using a medication. Okay. Let's ask this one. This is a super common one. Dr. Noble, if we're going to use a medicine, which medicine's best? Well, okay. Look, there's a lot of medicines to choose from. Let's look at them. In general, okay, now don't get mad at me, okay? But in general, I'm just going to say this. There's really only two general kinds of medications for ADHD. Okay. Now there's a bunch of others. You see at the bottom of the screen here, there's Strattera and Qelbree and Tenex and Clonidine. Those are great medicines that can also be used for ADHD, but they're not traditional stimulant medications. Okay. When you go into the supermarket and you got to get some ibuprofen or some Tylenol or whatever it is, you'll see a bunch of bottles that say a bunch of different names on them, but you turn around and you look at the active ingredients and you'll see that there's like the Tylenol or the acetaminophen group and there's the ibuprofen group, and they put a bunch of different names on it. Drug companies, when it comes to ADHD medicines, do the same thing, right? There are the methylphenidate group, which is on the left, and there's the amphetamine group, which is on the right. And there's a bunch of medications under each of these. This is not a comprehensive list, okay? There's new medicines that seem to be added all the time, but the question is, what category is it in, okay? Is it in the methylphenidate group or is it in the amphetamine group? Both of these medication groups are going to affect neurotransmitters in a very similar way, okay? Which means they're going to have very similar side effects. All right. And we are living in a moment where there's a significant drug shortage. Significant, right? And I can't tell you with certainty which one of these two groups has more of a shortage than the other. It really just depends. Families going to pharmacies to get these medications is kind of like whack-a-mole. It's just like you get here and it's like, well, we got 14 of these. We got 14 and a half of these pills. And then you got to go across town to get the other whatever. And then families just running around. And sometimes it's Ritalin and sometimes it's Zinzetti. Sometimes it's Avikio and sometimes it's Aptensio. We don't know. We can't anticipate. But what I want you to understand is in terms of how these medications are going to affect your child from a side effect profile, they're very similar. But please understand that when you're talking about stimulant medications, I'm talking about traditional ADHD medications that work. Okay. And that's the key. If we're going to manipulate the neurochemistry of a child's brain, let's use medications that are not only evidence-based best practice, but that work, like lights on, lights off, like work tomorrow's a different day work. Okay. If we're going to do it, let's do it. And let's use medications that we know will be effective. And that is these two groups. But I didn't answer the question. Right? The question is, well, Dr. Noble, which medication is best? Well, of course, I'm going to say it depends. But as a general rule, if your child is drug naive, meaning they've never been on an ADHD medicine before, they've never been on one, I will tell you, not only from personal experience, having taken both of these categories of medications, I would almost always advocate starting with a methylphenidate. Okay, starting with a Ritalin or a Concerta or a Quilichu or a Daytrana or any number of methylphenidate products. And the reason for that is because I have found them to be not only effective, but gentle. Okay, you get the support that you need, and then when you come off these medications, it's gentle enough that you don't feel like you fall off a 5-story building onto a concrete slab. Okay, now when I've been on amphetamine products, like Adderall as an example, Vyvanse as an example, yeah, there were times when I was coming off those medications that it felt a little bit more like I was falling off a 5-story building, right? When you come off an abrupt discontinuation of methylphenidates, that feels a little bit more like falling out of a 1-story building into a flower bed. Maybe you bang your head on a garden gnome. You're going to be okay. You'll dust yourself off. You'll still go to work tomorrow. When I discontinued abruptly amphetamine products, right, like Adderall and Vyvanse, I just decided I'm not going to do this anymore. It was like I fell out of a window, right? But instead of landing in a garden, it's like I landed in a pool, and the pool was jello, and I went all the way to the bottom of the pool, and I spent the next 7 to 10 days sleeping 12 or 14 hours a day and trying to swim out. Okay. Now, I think they're both great medicines. I think they're both fantastic. And that's been my experience. It doesn't mean it's going to be your child's experience, but in general, methylphenidates are I'd say more gentle. They're certainly effective. And I would suggest, in my experience, they're easier to discontinue. Okay. So that's how I answer that question. What are the side effects? Oh my goodness. Let's talk about it. The side effects are predictable. I say to families when they come to the clinic, right? Let's say this is your semester to start in ADHD medicine. I talk to you about all the things that we've just discussed, but now we get to the business part of this, right? Where I'm going to let you know with absolute certainty what's about to happen when we use these medications. I put my hands over my eyes and I say, you're going to think I'm a fortune teller. You're going to think I got a crystal ball, because I'm going to tell you with 100% certainty the things that are going to happen when your child takes this medication that you are not going to like. Here they are. Insomnia. Now listen. Insomnia or sleep onset difficulties really only happens when you don't take the medicines the way that I tell you to. That being said, sometimes kids are super sensitive and it doesn't matter, right? You give it at 6 a.m. and they still don't go to bed at night. There are those kids that are super sensitive, right? But if you ignore me and you say, well, I'm going to give my dose at 4 o'clock in the afternoon because Noble doesn't know what he's talking about because I know stuff, your kid's not going to sleep. Okay, you give that medicine, it's a 4-hour medicine, it's a 12-hour medicine, they have different lengths of action depending on what's prescribed. That kid's not going to sleep because these medications are not sedatives. They're not sedatives. Listen, these medications don't put kids to sleep. Here's what these medications do. They go inside and they go inside the house and they flip on every single light in every single room at the same time. Kids that are untreated for ADHD, it's like when you're walking your dog at night and you walk by a house, and there's a bunch of lights going on in different areas, like that, like in Home Alone, when he's in there and there's all these different things happening. That's what ADHD is like. But imagine when you start a medication, somebody goes to the breaker and flips it on and all the lights in the house turn on, all of them. Okay. These medications activate the brain. Right? So your child is going to be awake if you give this medication at 5 p.m. They're not going to sleep. So please, please, please listen to your clinician. Irritability is another side effect, right? These medications, as I've said, are not sedatives. They are not meant to slow down the RPMs of the engine. They're not meant to calm things down. They're meant to focus things, okay? And sometimes when you hyper-focus light in one direction, what does it become? A laser beam. And that sometimes can be really bad. So sometimes irritability can get worse. Appetite suppression can be really bad as well. We talked about that earlier, right? When the medications work, you're not going to be as hungry. Some kids do fine. Some kids do fantastic, right? But a lot of kids really, really struggle here, right? If it's a 4-hour medicine, for 4 hours, they're not going to eat. If it's a 12-hour medicine, for 12 hours, they're probably not going to eat. They'll eat some yogurt and 2 bites of a banana. Okay. But when they come home, after the medicines wear off, they're going to eat you out of house and home. So they're not going to wither away. They're not going to disappear. But please understand that their appetite will decrease. And then lastly, withdrawal. We talked about this earlier. Sometimes kids, they just kind of go inside themselves, right? Their world becomes less about lateral movements, about I'm running here, I'm running there, I'm doing this, I'm doing that. It becomes less about lateral movements and more about a long hallway, right? Every door's locked. There's an exit sign. It's 4 hours away. It's 12 hours away. I'm working until I get to the end and I'm going to go out the exit door and then I'm done. All these other doors don't interest me because I'm getting stuff done, right? So sometimes you can see kids withdraw. Why does this happen? Well, let's talk just briefly about it. These medications, right? They work on 2 neurotransmitters primarily. They work on dopamine, which is I'm having fun on a roller coaster. Look at me. I'm on a roller coaster. I'm having so much fun. I'm enjoying things. You gave me a compliment and that makes me feel good. I have this can-do attitude. Like I feel like things are good. This is mutually beneficial, right? Dopamine. They manipulate dopamine by increasing the presence of dopamine in the synaptic cleft. So they push it out and these medicines work to keep dopamine working, to keep that attitude going, to keep it up, and which enhances your ability to focus. And they also increase the presence of norepinephrine. Norepinephrine is fight or flight, okay? This guy with this knife, not your friend, okay? When you're getting chased around a city by a guy who's wearing a ski mask and a knife, it's unlikely that you're going to stop and say, you know what I am? I'm hungry. Let's get a slider. Let's talk this out. And then once we're done with that, we're going to take a nap. Unlikely, right? This guy is scary and you're going to run and run and run. Norepinephrine is fight and flight. So this is why kids don't sleep. This is why it's hard for them, to just completely relax because they're focused, they're working, they're making progress, okay? So dopamine and norepinephrine is why all these side effects happen. And it's really the same with whether it's the methylphenidates or it's the the Adderall products, okay? So the amphetamines. It's very similar, but that is why these types of things occur. How long is treatment needed? This is a great question. It's a great question because it underscores the likelihood that this child is going to get off of this medication. You know what my absolute favorite thing to do in the clinic when people come in and they're on a bunch of medicines, it's to say, okay, we are going to start getting rid of stuff. We're going to start getting rid of stuff because this is not meant to be the reality for your child. Do I aggressively manage medications? Yes, we have complex neurodevelopmental disorders that present to the clinic that require a number of aggressive strategies to provide some type of support to the family and the community and to the child. But if you're on ADHD and you ask me the question of how long does this child need to stay on this, I say you and I we're going to get along great, because it's not necessary for these children to be on these medications long term, right? Oftentimes they get to a spot where they're able to regulate their own attention, right? So maybe they're working an outside job. Maybe they're up and moving around all the time. Maybe they're not sitting under fluorescent lights and being measured with standardized tests. Once they get to that spot in their life, they can take a step away from ADHD medications. When does this occur? I'll tell you what, adolescents. A lot of adolescents come into the clinic and they'll be sucking on a rock star and, eating a bunch of licorice for breakfast. But when it comes to medications, they're super organic. They're like, you know what? I'm not putting any chemicals in my body, as they're just hammering energy drinks, right? I mean, yeah, there's a discrepancy. There's a logic gap there that I have some questions about. But in general, folks, maybe when they want to put on muscle mass, right? When they want to get bigger in the weight room, they want to really optimize their nutrition aside from the rock stars. Oftentimes getting rid of medications that are going to decrease your appetite is a goal. So a lot of times adolescents will start to question the necessity and value of this medication. So how long is treatment needed? Well, it depends, but it does not have to be a lifelong condition. I didn't start these medicines until I was in my early 30s. And I discontinued them in my late 30s and said, we're done. I retire. Okay. So you do not have to be on these medications for the rest of your life. Will you always have ADHD? Yes. These medications do not fix or cure ADHD. But what is, they give you a minute to try and think about how to be successful, what path to take, and how to optimize your day so that you don't let it get you into trouble. Are there non-medication options? Great question. As I sit in my office, I can see Whole Foods, and Whole Foods has all kinds of awesome, over-the-counter interventions that are, organic and can be really helpful. And certainly when it comes to ADHD, that is also true. There's a lot of things to think about, not just supplements, but you think about cognitive behavioral therapy, right? Where, you start looking at the thoughts that run through your brain and the negative thoughts that you over-focus on, and you work with the behavioral therapist or a psychologist to try and challenge those thoughts and understand what the truth is. What you feel is not always what's real. Sometimes kids need melatonin for sleep. I've done videos on that. I'd highly recommend you check it out. I'm a big fan of melatonin. In the short term, it's demonstrated to be very effective for kids. Omega-3 fish oils. These are also demonstrated to be beneficial in optimizing a child's ability to focus and attend to task. Elimination diets, right? I mean, removing MSG, glutens, dyes, sugars. While I don't think there's a big impact factor here when it comes to these kinds of things. What I want you to understand is that it does move the needle a little bit. And sometimes a little bit is good. If I can make your life 5% better with this video, then it's worth my time, right? Acupuncture has shown some benefit. Yoga has been shown some benefit. There's also computer programs like Endeavor RX, which requires a prescription from your doctor. And it's a computer program that helps kind of build your child's ability to focus on working memory and processing speed so that they can be successful in school. When do we stop treatment? Now, this is a different question, okay? This isn't the same as does my child have to be on this lifelong? This is a different question, okay? There are times when your child is taking your medication and it needs to be done. Okay, I mean, we are done doing this, okay? And I'm going to explain this to you. The first way I want you to think about this is the juice worth the squeeze? Is the juice worth the squeeze? These medications have side effects, right? You withdraw, your appetite goes down, sleep issues your anxious features can go up, irritability can go up. Is the juice worth the squeeze? If your child's in third grade, listen, I want your child to do well. I want him to be the best third grader on the planet, but I got to tell you something. Harvard doesn't start tomorrow, okay? Ivy League school doesn't start next week. We're going to be okay. Okay, so if your child is struggling and they're on a medication and the medication is increasingly problematic, the question I'm going to have for you as a clinician is the juice worth the squeeze? Are you getting more side effects than benefits? Yeah, I'm sure your child's doing okay, but for crying out loud, look at this guy. This was me circa 2012, and I was like 30 pounds less than I am now. Now, I didn't discontinue these medications because of the weight thing, but it was dramatic. Like my wife, which we'll look back on these photos and she'll be like, I don't even know who that was. I mean, I look like you know what I do? I look Look like a scarecrow who fell asleep in a Banana Republic and didn't have any clothes and had to like grab a bunch of clothes off the rack so that the scarecrow wasn't naked. Like, that's how I feel when I look at this photograph. Like, my skull is sunken, and again, like, there are times and seasons for that. And maybe, I could have decreased my dose. I could have optimized my nutrition. There's things you can do. That's not necessarily what's going to happen to you on your journey. But please know that for me, and maybe for you, the juice was not worth the squeeze, right? Do I have some trouble focusing? 100%. I have to write a bunch of stuff down. I have to have a bunch of processes and routines and schedules. I've got all these people around me to remind me to do stuff. I have like a visceral reaction to email. I'm like allergic to meetings. I mean, I try and really, honor what I can and can't do. But yeah, I mean, you take the good with the bad. But I feel good and I'm on track and I'm doing okay. Are there days when I miss ADHD medications? Yes. Oh my goodness. Yes. Particularly when I'm having to do stuff I don't want to do. So I think that might be it. I think that's all the slides I have. So if there are no questions, listen, I want to thank you for taking time out of your lunch hour to spend with us. I'm going to try and do these live streams every week. I'm going to pick different topics. When this goes on the upload and you have comments or questions about this that aren't mean, I'd prefer it if they weren't mean, put them in there and I'll try and respond to them with shorts or additional videos. This channel exists for you to try and give you the support that you need. You have one of two choices, right? You can ask your doctor for a referral and sit on a wait list for 9 to 12 months to see somebody in your community or somebody like me, or you can tune in every Wednesday and get your questions answered to the best of our ability immediately. Let's use the internet for something good. Thank you for your time. Have a great day. Stay tuned for more.